Haven for Hope is not just a shelter for food and water and those necessities, but it's really a whole transformational village. It's to help people transform from the streets to a better life.
Haven benefits its patients and its community at large because we get to treat a lot of really common skin conditions that these patients wouldn't have access to that care and some of the medications that we give otherwise. We work with a lot of underinsured or uninsured patient populations, and so this is really incremental for both preventative care, for a lot of dermatologic conditions, and for just recurring treatments that patients need.
I particularly love working at Haven for Hope because I think Haven for Hope as an organization is one of the bright lights in our city.
We provide a lot of diagnostic care and preventative care for dermatology. We do treatment of really common skin conditions, things that you would see day to day, but that can turn into bigger issues if you don't treat them earlier.
Because I love to work with our students and to teach them medicine and to teach them to be the most compassionate doctors they can be. I look forward to seeing patients who have limited access to care and the fact that we can see them for free and provide health care for people who otherwise slip through the cracks in our healthcare system. It's a pleasure to be providing that service and to be teaching students about giving back to the community.
I think the thing that gets me really going when I first get here to clinic is just seeing some of our patients that we see a little bit more frequently, so kind of some of our longer-term chronic care patients, because we get to see how they progress through their disease and just how the difference that we're making, even when it feels like just small incremental changes that we're making in their appointments.
I think the major obstacles are time and space, because we have more people who need our services than we have space and time in our clinics.
Our access to certain medications that can be a little bit pricier. Some of our patients require certain medications that we just don't get often, and that's always really hard to have to tell them we don't have that anymore. And so I think improving our access just to treatment options would be my #1 priority. Haven for Hope has taught me a lot about just some of the barriers that can come with care. So it's not just about whether we're able to see the patient that day. It has to do with, whether they can get access to certain scans or things that they need for diagnosis, whether that's for treatment, diagnosis, any of that process. There's just a lot more that goes into treating patients than just what you physically see when you are with them.
It really comes down to compassion and empathy. It's about showing people that you care, making people feel comfortable so that they can tell their story and be vulnerable and allow us to help them. And when we're non-judgmental, then we can provide the best healthcare we can.